For full-time employees, the county pays 80% of the premiums for all medical plans except the Premier plan. This plan is the county's most expensive plan. The county pays 80% of a lower cost plan, and the employee is responsible for the difference. The next slide will show you an example. For the dental plans, the county pays 100% of the employee-only premium for the standard and core plans. Employees are responsible for the difference between the standard and buy-up plan premium cost, as well as paying 100% of the dependent coverage. The vision plan is also paid at 100% by the county for employee-only coverage, unless you enroll in the buy-up plan. Employees can enroll their dependents in the vision plan, but they also have to pay the full premium cost. All of the summaries, enrollment forms, and premium information can be found on the Human Resources website, as noted on this slide. This slide shows an example of the premium differential between the Select and Premier plan. As stated in the previous slide, the Premier plan is the highest cost county medical plan with the most provider network access. The county contributes 80% of the Select plan premium, and the employee is responsible for the difference in the cost on the Premier plan. So as you see above on this slide, it shows a total premium for the Select plan of $1,861.11, and for the Premier plan at family tier, it shows a total premium of $2,017.36. The county's contribution is 80% of the Select plan for both of these plans, or $1,488.89. As you can see, the employee's biweekly cost will be higher if you enroll in the Premier plan. There are 7 medical plan options offered to full-time employees: the Select Exclusive, Select, Premier. These 3 are self-insured plans. Then we have the traditional Kaiser HMO, the Kaiser High Deductible Health Plan, the traditional Sutter Health Plus HMO, and the Sutter Health Plus High Deductible Plan. I will go into detail of each of these plans on the next several slides. Let's talk about the Select plan highlights first. The Select plan is administered by Lucent Health and utilizes the Anthem Prudent Buyer Network. On this plan, participants must utilize facilities and providers within 3 counties of the Anthem network: San Joaquin County, Sacramento County, and Stanislaus County. There is a plan year deductible of $250 per person or $500 for family coverage. The plan year runs from July to June. For any claims or member questions, you can contact Lucent Health between 6 a.m. to 6 p.m. Monday through Friday. We also have an in-house representative, Tara, who is available to assist participants between 7 a.m. and 4 p.m. Monday through Friday. The next plan is the Select Exclusive plan. The Select Exclusive plan is the same premium cost as the Select plan and is also administered by Lucent Health. The difference is that the Select Exclusive plan utilizes San Joaquin County Health Care Services only. The in-network facility is San Joaquin General Hospital. It has a slightly lower deductible plan than the Select plan. It is $125 per person or $250 for family coverage. Just like the Select plan, the plan year runs from July to June. This slide shows you a summary of co-payments for office visits and emergency room visits for the Select plan. An office visit is $10, but if you go to a provider at San Joaquin County Healthcare Services, it is $5. ER visits are $100, but if you go to San Joaquin General Hospital, the copayment is reduced to $40. The Select plan also has drug coverage. It covers generic drugs at $5, brand name drugs at $15, and it does not cover non-formulary drugs. The last self-funded plan that the county offers is the Premier plan. And again, this is the most expensive plan that the county offers. This plan utilizes the Anthem Prudent Buyer Network, just like the Select plans, but it is not limited to the 3 counties. It is countrywide. Employees who desire access to the most providers and/or have children out of the area benefit the most from this plan. As you are aware, some insurances have limited networks, and children off at college, as an example, may not be able to have access to these types of plans. That is where the Premier plan would work best for your family. The deductible is $125 per person or $250 per family, and also runs on a plan year from July to June. Office visits are a $5 copay. This plan covers generic brand, and non-formulary drugs at $5, $10, and $30 respectively. The Premier plan is the only drug plan that covers non-formulary drugs. The Kaiser plan is an HMO, which stands for Health Maintenance Organization. This type of medical plan model requires employees to select a primary care physician and obtain referrals through that physician to see a specialist. The exception to this rule are services rendered for an OB/GYN or mental health services. Participants can only use Kaiser facilities except in the case of an emergency. Any hospital worldwide can be used in a true emergency situation. In Stockton, Kaiser is contracted and part owner of St. Joseph's Hospital, so that is also a facility participants can utilize. An ER visit is a $100 copay. Generic and brand drugs are covered at $10 and $20 respectively. Kaiser also offers a high deductible health plan to county employees, and it's one of our newest plan offerings. This plan is automatically paired with a health savings account, and that I'll explain later in this presentation. It is similar to the traditional HMO plan in that you need to use a Kaiser facility and coordinate your care through your primary care physician. The biggest difference in the Kaiser high deductible versus the Kaiser HMO is the payment structure. This plan is a co-insurance plan where the participant pays a percentage of the cost of care, while the traditional HMO uses a flat dollar copay. In addition, participants must meet a calendar year deductible first before the plan pays anything. The deductible is $1,500 for an individual or $3,000 for family. When an employee enrolls in this plan, the employee is automatically enrolled in a health savings account. This plan deductible is much higher, but the premiums are lower than the Health Maintenance Organization or HMO plan. Sutter Health Plus also offers an HMO and a high deductible health plan like Kaiser. Benefits are very similar, however the networks are different. The Sutter Health Plus is relatively new to the county. The Health Maintenance Organization, or HMO plan, was introduced in July of 2019. This plan utilizes Sutter Health facilities, and you must remain within your selected medical group. It is a very rich plan, meaning that the benefits are very good at an affordable copayment. The office visit copays are $10, and ER visit copay is $50. In regards to the prescription drug program copays, it is set up as tiers. Tier 1 is considered a generic drug, Tier 2 is a preferred brand drug, and Tier 3 is a non-preferred drug plan. The Sutter Health Plus High Deductible Health Plan is another new medical plan that was introduced to county employees in July of 2020. The coinsurance and deductible structure are the same as Kaiser High Deductible Health Plan. Just like the Sutter Health Plus HMO, participants must use a Sutter Health Plus network and remain in the chosen medical group. Both Sutter Health Plus plans are calendar year plans. This means the deductible and out-of-pocket maximums accumulate from January to December. For all 7 medical plan options afforded to county employees, emergency care is available at any hospital worldwide, even if it is out of the network. However, if you are required to come back for follow-up care, such as a removal of a cast as an example, you must obtain that care within your plan network. Please note that participants enrolled in a health savings account with a high deductible health plan may not enroll in a health flexible spending account. This is an IRS requirement. Now let's talk about the Health Savings Account. The acronym for a Health Savings Account is HSA. HSA participants are able to enroll if they're enrolled in a high-deductible health plan offered by either Kaiser or Sutter Health Plus. An HSA is a savings account that allows enrollees to pull funds tax-free when used for approved medical expenses. The IRS establishes the maximum amount that an employee can contribute into the HSA each calendar year. For the 2021 plan year, it is $3,600 for an individual or $7,200 for a family of 2 or more. The county will contribute $700 a year for an individual and $1,400 a year for an employee who has enrolled dependents into the HSA. The contributions are provided over a 26 pay period time frame, so you will not have immediate access to the total county contribution. The amount that the county is contributing is part of the IRS maximum allowable amount. Therefore, you can contribute the difference between the IRS maximum and what the county will contribute on your behalf.